The idea behind this series is to really bring together faculty and experts from FSU with folks from the community who are experts and doing very good work on topics related to behavioral and social science. And our first topic today is behavioral and social aspects of vaccine hesitancy. We're so delighted. We have a number of wonderful experts and guests with us today to share some information on this topic with you. Just to give you a quick overview of who you'll be hearing from. First, Dr. Shamiel Roberson, the Deputy Secretary for Health at the Florida Department of Health. We're delighted to have her. Dr. Meredith Poole Burgess, who is a faculty member here in the Department of Behavioral Sciences and Social Medicine. We'll be hearing from Pastor Roosevelt Rogers, who is a reverend at Old Jerusalem Missionary Baptist Church in Havana, a community advocate, a community leader, and former colleague here at the department at the College of Medicine. And then we also have Ms. Tanya Hobby, who's the interim health officer at the Department of Health in Taylor and Wakulla County. So we have a wonderful group of speakers today. I wanted to just acknowledge a couple of other folks who are with us. Dr. Dan Van Dermy is our Senior Associate Dean for Clinical and Community Affairs and has really been leading the vaccine and COVID efforts through FSU, working closely with the community. We also have with us Mr. Marcus West from the Leon County Health Department. I'll say a little bit more about Mr. West's work later, but he is really leading our countywide efforts to educate and empower the community around vaccinations and COVID. So without further delay, I am delighted to welcome Dean John Fogarty, Dean of the College of Medicine here at Florida State University, who will say a couple words to kick us off, and then I'll turn it over to our panel. Dr. Fogarty?
Thank you, Heather, and welcome to all of our participants today. It's great to see you all on Zoom. We wish we could be doing this in person, but this seems to be the way things are. When Heather had the idea several months ago to develop a Grand Round series, little did we know how timely this particular topic was going to be for us today. Given what's going on with COVID and the Delta variant and all, there's obviously a big push to get more and more people immunized. And so I think this topic today is particularly relevant. We've had several of the local TV stations that want us to come and talk to them about vaccine hesitancy. We've told them we just happen to be having a Grand Rounds on that topic today. So again, I thank you. I know the Delta variant has maybe pushed some people to go reconsider their vaccine hesitancy. It looks like that we're ramping up a little bit in terms of the number of vaccines being delivered around town and around the country, and that's good to see. But again, I thank our panelists for being with us today and sharing their insights and their views, and thank all of you for participating. This is a great program. Thank you very much, Heather.
Thank you, Dr. Fogarty. We appreciate it. We'll turn it over to the leader of our committee, Dr. Bryant Howren, who is also a faculty member in our Department of Behavioral Sciences and Social Medicine. Dr. Howren.
Thank you, Dr. Flynn. Good afternoon, everybody. I'm very pleased to introduce our first speaker, Dr. Shamiel Roberson, who began serving as the Deputy Secretary for Health for the Florida Department of Health in November 2019. Dr. Roberson has previously served as the department's Director for the Division of Community Health Promotion and Bureau Chief of Chronic Disease Prevention. She's a graduate of FSU, where she earned her bachelor's degree and later completed her master's degree in public health. She earned her doctorate of public health from Florida A&M University. So she will tell us a bit more about how the state of Florida is performing regarding vaccine uptake and some general issues surrounding it. Dr. Roberson, I'm going to share screen and pull your slides up, so just let me know when you would like to advance.
Thank you so much. So good afternoon, everyone. Again, I'm Deputy Secretary for Health here at the Florida Department of Health, and I'm going to share some general updates on where we are with COVID-19 vaccines and a little bit about our infrastructure of our public health services in the state of Florida. Advance. So at the Florida Department of Health, unlike many other states, we have what's called an integrated public health system. So we have 67 county health departments and we have a state health office. And what does that mean for Florida in terms of COVID-19? So I'll give you an example. In other states, they can have county health departments, city health departments, state health departments, and they're all separate entities. In the state of Florida, this integrated system allows us to have uniformity in the way we communicate data. We have the ability to move resources. So for example, if we've identified in a county that there are more resources needed for vaccines, we have the ability to move our people very quickly. In terms of our epi capacity for case investigations, things of that nature, we assess the need, and if need be, we can, mobilize, look at data across the state, and then we can work for quality assurance and make sure we put people where they need to be. So it's a uniform approach. We speak on a regular basis with all of our county health departments. We have resources in place where we can quickly identify, and it's a uniform process, if counties are in need of resources, and then we mobilize those things. We're currently operating in an incident management structure that allows us to, figure out what's going on in this state and quickly triage and move to what's necessary. Next slide. So we've really progressed a lot during this pandemic, to not having vaccines last year. And now we have 3 vaccines that are approved by the U.S. Food and Drug Administration that are under emergency use authorization against COVID-19. We have the Pfizer vaccine, which is recommended for persons 12 years and older, 2-part series vaccine. We have Moderna. This vaccine is approved for persons 18 years and older, 2-part series. And then we have Johnson & Johnson vaccine, which is, a 1 vaccine for persons 18 years and older. Now, what's important to note, and a lot of people are confused on this, is when you're fully vaccinated. So this really matters because you're fully vaccinated 2 weeks post Pfizer and Moderna and 2 weeks post 1-shot series for Johnson & Johnson. So it's important, if you have received 1 vaccine of Pfizer and Moderna, that people don't think that they're fully vaccinated. There is a difference, and you don't have the same layer of protection as if you were fully vaccinated. Next slide. So what are some of the benefits of the vaccine? And this is what we're trying to get people to understand in the public. Vaccines are safe. They're effective. There are a lot of different mechanisms in place to look at the efficacy of this vaccine, to really, communicate to the public. And, one thing that we have to note in this pandemic, it is very different when we're dealing with a scientific audience versus us dealing with an audience that is not as scientifically advanced. So it's important that we have basic messaging so that we can communicate to the public. We need to let people know that this virus is very different with different populations, and it can reduce the risk of severe symptoms, hospitalizations, and we want to reduce the chances of death from this. It teaches your body how to fight against the virus and, minimize the ability of this virus to spread amongst more vulnerable populations. Next slide. So at our Florida Department of Health website, we are updating, vaccine locators and testing sites statewide. So we're working with those local communities to make sure that people understand where they can get a vaccine. We're also working to make sure that we have updated information on testing sites. And those are testing and vaccine sites that the Florida Department of Health may be hosting, or testing and vaccine sites that are sponsored by community-based partners. What we're striving with in conjunction with communities is to make sure in every county in the state, we have adequate amount of vaccines available and adequate testing capacity. So if individuals are, wondering whether they're in Tallahassee or in other parts of the state where you can get a vaccine, where you can go for testing, they can visit floridahealthcovid19.gov, and they can use that vaccine locator and that testing locator. And it's important to note that, as the Florida Department of Health and a lot of our community-based sites, this vaccine is a free resource. And, in a lot of the testing sites, the testing is free as well. So, for example, we have a health equity site that's located in the Tallahassee community at Florida Agricultural and Mechanical University, where vaccines are available and testing services are available. That's just one example of that site that'll pop up on vaccine and testing site locator. And we're working to make sure that we're updating this on a regular basis so that the public is aware of where to go if they need a test and where to go to find a place where they can receive a vaccine. Next slide. So every week, at the end of the week, we put up a vaccine in-case report. This is a snapshot of the vaccine report. As of July the 30th, this was posted on last Friday. More than 11.7 million people in the state of Florida have been vaccinated. In Florida, we have more than 22 million people, and we have more than 100 million visitors a year in the state. So this is a way where you can see a quick snapshot of the amount of people that have been vaccinated in the state of Florida. So this is something that we're putting out to the public just so you can kind of get a general idea on where we are with vaccines. Next slide. So of course, after we received this emergency use authorizations naturally in the state, you can see at first, there was a gradual increase on the number of vaccines that were disseminated in the state. And, we've been kind of at a plateau state for a while with vaccines. And last week we seen, quite a bit of an uptick. So we are seeing, nice increases in the number of people that are being vaccinated, and that is encouraging. I just want to reiterate, at the Florida Department of Health, we are promoting that vaccines are safe and effective, and we really want people that are eligible under that emergency use authorization from the FDA. We want people vaccinated. Next slide. So, really, if we get into strategies to reach hard to reach populations and what we've done in vulnerable populations. So at first, when we had this vaccine, we did a lot of health equity sites. We've sent out mobile vaccine clinics to different areas of the state to make sure that we really have good vaccine coverages. When we're looking at the state, we're looking at the data, understanding where we have vaccine uptake, where we don't have vaccine uptake. That was an opportunity. In Florida, we understand that we have one of the largest elderliest populations in the United States. So, really protecting the vulnerable is very important. So some of our first missions, when we received the vaccine in the state, we really worked to get those vaccination rates up at long-term care facilities. And we did this using strike teams. So, people would go out to those long-term care facilities, educate the staff, educate the patient population in that facility on what the vaccines were, and we disseminated the vaccines on site in conjunction with those facilities, working in partnership with Agency for Healthcare Administration. And we have a routine process in place where we're going back to make sure that, persons are vaccinated and educated. And a lot of people have their own mechanisms for vaccines, and then the county health departments help as needed if there's a need in those facilities. But there's still a mechanism in place to make sure that we watch outbreaks in congregate settings and that we promote vaccines in that setting. We have a lot of people in the state that are homebound. So we did a homebound vaccination program to make sure that if a person could not go into a vaccine site, that we would take the vaccine to them. And that has been very, helpful throughout the state. And we vaccinated a lot of individuals that were homebound. We went directly into their home to provide that vaccine. And, they can still, if there's a need for a home-based vaccine in the state of Florida, we have a website that's up for people to send in an email to request a homebound vaccine, as well as they can reach out to that local health department, and we'll make sure they get to the right place, and we'll take that vaccine in home if necessary. We provide a lot of guidance for healthcare providers about the vaccine and how to order the vaccine. This vaccine is required to be reported into Florida Shots, our division of medical quality assurance that oversees all of the licensed providers in the state of Florida. They send out constant guidance when EUAs are released. Our guidance is revised. We make sure that we send out mailers through that division of medical quality assurance so that they can get this message out to healthcare providers. When it was an option for us to add, people as vaccine providers for COVID-19, we send out information on how to become a provider, how to order, how to transfer vaccine, things of that nature. We've worked in close collaboration with federally qualified healthcare centers because they seek to serve uninsured and underinsured. That's very important. And we know in Tallahassee, we have bonds, we have neighborhood, both are FQHCs that local communities work with to make sure that people understand that they're given vaccines. They have testing capacities as well. And we use this resource throughout the state of Florida. So those are some things. We disseminated vaccine to FQHCs before they had a process in place to order on their own, just to make sure that we were reaching some of those vulnerable populations. Early on in the response, and we've done this with other chronic conditions, as we've disseminated information through beauty shops and barber shops and faith-based organizations I really want to note when it comes to vaccine hesitancy that it is very important to include faith-based communities. That has been one of the most successful partners that we've had, in terms, especially with minority vaccine uptake. So really using those faith-based organizations to go in and do, clinics. And we've had a multitude of models in different counties on how they've done this. Some people have done drive-in vaccine sites. Some people have done them actually, in that faith-based organization inside of that building. Some people have taken that model and went door to door to do faith-based outreach. But, really partnering with those faith-based leaders are effective in other disease areas as it relates to population health, but it has proven to be very effective, with vaccine uptake. So we encourage those continued, for example, there's a concept called pulpit messaging. So making sure that there are points that are given that vaccines are safe, they're effective, and having those faith-based leaders, steadily, give that message over and over, and encouraging their congregations to go out and tell that message, force multiplying that message with this is very important, and having trusted members from the community to do that. This has been a model that has worked. We've shared it with many other states, is working in that area. And this is a tool that we continue to use. And if faith-based organizations want to seek missions, they can submit those submissions to their local emergency management entities for a mission to continue to do some of those pods at faith-based organizations. We really want to increase vaccines, and that is one way that have been effective, and we want to continue to do that. Next slide. So with those collaborations, for example, I talked about faith-based organizations, but we've partnered with many colleges and universities, and we really want to take this time to highlight our partnership with Florida State University. So Florida State University have helped to disseminate vaccines throughout their, faculty and staff, and we really appreciate it. They've been a partner, hosted, the CDC director when he came to just talk about the university landscape. Our state surgeon general, Dr. Scott A. Rifkes, have worked very closely with the leadership at Florida State to make sure that they were champions in the fight against the virus and with vaccines. And we're very appreciative for that work that they've done. We've worked very closely with FAMU in town as well with that community-based site. And currently they're working on messages for minority communities. We acknowledge that those vaccine rates are a little bit lower in minority communities. So we're really working to disseminate that message amongst the student. They're launching a campaign with the SGA to try to get those vaccine rates up and really pushing that message in the community. We're continuing to expand our statewide media campaign in our efforts to increase education and awareness around the vaccine. Next slide. So we have a media campaign provider that's doing statewide campaigns, and we have multiple ways in which we're communicating. We have social media, we buy ads, we do a lot of different things. We do print media, we do whatever is indicated in that media market. We really use a social marketing concept. So we look at those concepts that drive behavioral type changes to make sure that the things that we're doing are effective. We look at impressions, we look at retweets, we look at that type of thing, and then we tailor messages that are very specific for those populations, and we do what resonate with those populations. We have a lot of experience with social marketing, as it relates to Tobacco-Free Florida and our large media campaigns. We have a lot of experience in programs such as HIV to make sure we understand how messages resonate. In Florida, we have, large counties, we have metropolitan areas, we have rural, we have medium-sized counties, we have different people. I want to note that everything that we're doing in the state of Florida, we translate in Spanish and Haitian Creole. We have very large Hispanic populations in South Florida. We have very large Haitian Creole populations. So it is very important that we have culturally competent and culturally sensitive messaging, and those media providers work with those communities to make sure that the messages are appropriate for the communities that we want to target. Next slide. So we have a PSA, and I'll stop and let them play it for a second.
Floridians are fighting back.
We are coming together to do our part.
Getting a vaccine can protect not only you, but your loved ones too.
It's easy,
It's safe.
and it's effective.
It doesn't matter where you live.
Or what you do for a living.
If you are eligible to receive a vaccine, there's a vaccine available for you.
As we get back to normal,
Let's do this together.
So that is an example of a PSA that was focused towards North Florida. So if you were seeing this PSA in South Florida, it's a different clip. So we ran this one statewide at first, but we are working on additional PSAs to have those local leaders from different areas included in the PSAs so that we can get the message out, because what we want people to understand is that this vaccine is safe, and we want to encourage people and we want them to hear from public health professionals and members of the community to let them know that it's okay to get a vaccine. And we want to acknowledge, and not shame people that's unvaccinated, but really provide that education, because sometimes, it's the difference between, somebody just educating you on things that you may not know. I've been to a lot of local events in the Leon County area and, provided education alongside the College of Medicine, Dr. George Russ and Marcus West at these events, making sure that the public is educated on what's going on. Next slide.
May have to.
And on that next slide, I have resources, because one of the things that I want to note is a lot of information that we're receiving and updates that we're providing is on that website, floridahealthcovid19.gov. So that is a good resource, like I said, where you can find vaccine locators, or you can share with partners across the state on how they can promote the vaccine, to put that message in, because we're steadily updating with those local communities where people can find vaccines and testing sites, and it is increasing. So we really encourage people to go there. And then you can find information on vaccine infographics that you can share with partners. And again, like I said, it's available in English, Spanish, Haitian, Creole that you can share. We have a communication toolkit on ways to talk about the vaccine, some other resources that are readily available. We have the CDC COVID-19 vaccine webpage and the FDA page, because some people want to know a little bit more about that emergency use authorization and what that entails. So these are some common resources that we have, and I just want to share that. But want to thank everybody for, having this forum. This is a great forum. Vaccine hesitancy is something that we've known about for a long time. So it's going to take multiple mechanisms of communicating to people that vaccines are safe, vaccines are effective. We at the Florida Department of Health are promoting vaccines, and we really look forward to working with community partners across the state of Florida to increase vaccine uptake. Thank you so much.
Thank you, Dr. Roberson. We really appreciate you joining us today, and that was very informative. Let me move forward and introduce our next speaker here. Our next speaker is Dr. Meredith Poole Burgess, who currently serves as research faculty for the Department of Behavioral Science and Social Medicine at the FSU College of Medicine. She earned her doctorate of public health and behavioral science and health education from Florida A&M University, and then joined FSU in 2019 as a member of the research team at the Center for Translational Behavioral Science. Her previous roles include clinical research associate for the FSU College of Medicine Network for Clinical Research and Training, and a project coordinator within the Florida Department of Health Public Health Research Unit. I am going to share screen again and pull up her slides very quickly. Bear with me 1 second. Got to end one show and start another one.
While you're doing that, I'll just mention that we will have a few minutes at the end for questions. So maybe hold off on your questions and comments. Thank you very much.
There we are. Take it away, Dr. Poole Burgess.
Great. Thank you so much for the introduction. It's such a pleasure to be on this panel. I'm in this committee, and I'm so happy that we are moving forward and doing a community rounds and bringing together different community voices for this particular issue. You can advance to the next slide. Before I go into sharing some of my findings from my previous research, I wanted to just take a moment to just sort of put some definitions and some terms behind vaccine hesitancy and vaccine confidence. So we hear a lot vaccine hesitancy, and it refers to the delay in acceptance or refusal of vaccines despite the availability of the services that can provide vaccines. Hesitancy is also seen as complex and is context specific, and it varies across time, place, and the actual vaccine that you're talking about, and even populations. And it's influenced by factors such as complacency, convenience, and confidence. So if we want to go a little bit further beyond vaccine hesitancy, we see one of the things that influences that is the confidence. And that's a term that I've just been hearing a lot more of, because sometimes it's not being hesitant, but it's the lack of confidence in a vaccine. So vaccine confidence is looked at as the trust that parents, patients, and providers have in the recommended vaccines, the trust they have in the providers who are administering the vaccines, and as well as the processes and policies that lead to the vaccine development, the licensure, manufacturing, and recommendations for use. So I just thought it was just very important to set the stage with those two terms and definitions. So as we think about what community members are facing when they are having to make health-related decisions in regard to vaccine use, in particular the COVID-19 vaccine, that we are aware that it might not be hesitancy, but more so vaccine confidence. Next slide. I wanted to take a few moments to just share some of the findings that I have in my research. For my particular research, I looked at HPV vaccine challenges and opportunities, or barriers and facilitators, among minority women in the Big Bend area. So the Big Bend area encompasses 14 counties that are across North Florida. So this research actually looked at Black and Hispanic women in the Big Bend area, and it was qualitative in nature, meaning we did individual interviews. We had 16 interviews with women 28 to 45 years old, and all of the women had at least one child that were vaccine eligible for the HPV vaccine, and that was between the ages of 11 and 21. The representatives in this actual sample came from Leon, Gaston, Jackson, and Jefferson counties. Some of the things we did with this particular study is we explored the barriers and facilitators of HPV vaccination for their children. We looked at behavioral beliefs, which is their attitude towards the vaccine, normative beliefs, which is, in so many words, what's happening around them, what is the norm for what's going on around them, and then control beliefs, which looked at their access and their ability to perform the behavior. Next slide. So some of the study findings that we found out was some of the barriers when it came to moms getting their children vaccinated with the HPV vaccine was risk perception, mistrust, things going on in the interpersonal environment, so people close to them, negative healthcare experiences, societal norms and culture, so taking a step out from interpersonal environment and looking at what's going on in their normal culture or their community, and access, knowledge, and time constraints. I wanted to take a few moments to share a few quotes that I received, and keep in mind this is relevant to the HPV vaccine, but I do believe that some of these things are related to vaccine hesitancy and confidence in terms of the COVID-19 vaccine. So one of the quotes is, "Fear tactics make me not trust it." Another quote, which Dr. Robeson just actually addressed when she was talking about social marketing, it says, "It needs to be put out in the African-American community too. The commercials are kind of geared towards white people. There aren't no Black people in there. Kind of like they have the McDonald's commercial geared towards a Black person. They need to have a commercial geared towards a Black parent. When I think back, I don't remember no Black people in the commercial." Two more quotes, which sort of feeds into mistrust and misinformation. "I heard it affects Black girls' menstrual cycle. And I heard someone got lupus from the HPV vaccine." And I thought those quotes were just very telling. I love qualitative research because it gives you some context and how people are thinking. But, that misinformation feeds into the mistrust. It feeds into the risk perception, and it feeds into a barrier that prevents people from wanting to get the vaccine and trust the vaccine. For some facilitators for HPV vaccination, and I just want to point out, this is parents initiating the vaccine series and completing it, because the HPV vaccine is a 2-shot series similar to COVID. Some facilitators was awareness and knowledge. Personal experiences was influencing risk perception in a positive way. Provider relationships and that provider facilitation, and then social marketing and influence targeting minority communities, schools, and churches. Some quotes for facilitators include one that is an example of risk perception as a facilitator. This person said, "I had a pap that came out abnormal. and I had a biopsy done on my cervix. It came to be that I actually had HPV. So it was negative for me mentally. If I can prevent my child from going through that, I'm going to do what I have to do. Another quote that was a facilitator is, a good relationship with our doctors benefit the whole family. Healthcare has to have a picture of the whole family. Another one is informing parents more and giving information that can reach parents of different backgrounds, which Dr. Roberson just addressed as far as their different tactics to reach different backgrounds and populations. And the last one is, it would be good if they could target churches and communities where minorities are. So I thought that those quotes were very telling when it comes to facilitators, when it comes to vaccine uptake. Again, this is in particular to the HPV vaccine, but I do believe that some of this is relevant to the COVID-19 vaccine conversation that's going on now. Next slide. So I want to make sure that we bridge what we know. HPV vaccines have been out since 2006 and have made some extreme progress in increasing uptake, especially among adolescents and minority communities. So we want to make sure that we're able to bridge those things that we know about HPV vaccines and other vaccines to the COVID-19 era. Some of the takeaways that I feel are relevant to the COVID-19 era is that provider recommendation is a primary facilitator. You see this across all the literature. You see this when it comes to different people's perception. If the provider recommends it, it is a primary major facilitator of increasing uptake of vaccines. Risk perception attitudes weigh heavy in on decisions to receive the vaccine. So if a person feels like they have low susceptibility to actual illness, that is going to influence their healthcare decision on getting that vaccine. So I do think that we have to be careful to not mix in fear and mistrust tactics to influence risk perception. But I do think that it's valuable to inform people of their susceptibility to COVID-19, for example, to help weigh in on their decision to receive a vaccine. Again, misinformation negatively influences attitudes toward the vaccine, which feeds into mistrust and leads to negative behavioral intention. Understanding health decision-making influences of parents and mothers, those that's making the health decisions for their family, is a key factor. Culturally tailored promotion, education, and marketing to appeal to diverse populations is going to be key when it comes to reaching those underserved populations, those that are impacted very hard by COVID-19. And then cultural norms and peer dialogue. I had a lot of conversations with people in regard to COVID-19 that expressed that it wasn't until people around them were getting the vaccine and talking about it. It wasn't until it was a repetitive conversation in their norm, in their inner circle, that influenced them to go get vaccinated. And then some of them would call and talk to people and say, okay, well, how did the vaccine make you feel? And those things instilled confidence in them to go get the vaccine and to not be scared. Or even having someone, me personally, my personal story is I had a friend that was on FaceTime with me the whole time I went to go get the vaccine. It took a lot for me to get there, but that I think it's important to realize how much community impacts healthcare decision making. So just influence among community members and community networks. Next slide. I think that's it. Thank you.
Thank you, Dr. Poole Burgess. That was very informative, and a lot of those quotes really stood out to me. And in terms of making sure that all of the materials that we use are representative of all groups, and particularly those that we're trying to reach who are underserved. So thank you for sharing that. Let's see. Now I'm going to pull back up. I think I've stopped screen sharing. Okay. And I see Pastor Rogers popping up here. I want to introduce him. Our third speaker is Pastor Roosevelt Rogers III, who serves as pastor of Old Jerusalem Missionary Baptist Church in Havana, Florida. He's been in the ministry since February of 1999 and previously served several roles at Old Jerusalem, including associate minister, youth director, and men's ministry leader. He currently also serves as the director of protocol for the Northwest District of Florida Full Gospel Baptist Church Fellowship. Pastor Rogers is a graduate of Florida A&M University and was previously affiliated with the FSU College of Medicine as a STRIDE program coordinator. Pastor Rogers, can you tell us some more about the successes you've had reaching individuals in the faith-based community about getting vaccinated? and how this approach is able to reach those who are in outlying areas who we may not be able to access as readily.
First of all, let me say thank you for being a part of this panel. I am a proponent of anything that is health related in our communities. I have a personal model where I believe in connecting the churches to the clinicians, ensuring oftentimes that our parishioners within the faith-based community tend to listen to the pastors and messaging coming from the pulpit. And so what we do is we make sure we echo what is coming from the medical sides of things. And so two events that I can speak of personally was around May, we had some persons reach out to us. And so our church partnered with another church in Havana, New Jerusalem Missionary Baptist Church. And we were able to successfully coordinate a vaccine drive-through. And I believe that we vaccinated in excess of 500 plus individuals, both for their first and second shot. I think what helped the most was universal messaging. We were all saying the same thing, that the vaccine is safe, that we believe that taking the vaccine will help you. So that was key. The second one is we've been working with organization Healthy Heart, and that is a pipeline of churches that dealt with a lot of cardiovascular issues. But since we already had that pipeline, we were able to connect the churches throughout Gaston County and allow different sites. And so we've been doing that since July, and it'll run through the 14th of August. And so we set up different locations throughout the Gaston County community because one of the issues is transportation. And so we wanted to make sure that persons who could not get to a facility would have that come to them. So it's pretty much mobile. So we actually have one this coming Saturday at Havana, at our local K through 8 school. So any persons who want the vaccine who haven't had it are able to go there to that site and receive it. And so I just believe that if we are promoting the same message, that we are promoting the reward over risk, because I think a lot of times it's the misinformation and being truthful. And then I think the other key component is that the pastors and spiritual leaders are engaged in conversation, engaged in settings like this, as well as promoting that we're not going to ask you to do anything that we haven't done. And so many of the pastors in the areas have already received their vaccines, and we talk about the experience. Personally, my entire household, my 13-year-old son, my 18-year-old daughter who will be attending college, my wife and myself, we've all been fully vaccinated because we want to promote what we're asking the others to do. And so I think working within the community, as Dr. Roberson has said, as well as Dr. Meredith, that we've got to make sure that we are connecting the faith-based organizations in our communities, because I think a lot of the messaging will be able to be dispersed throughout the community because the parishioners tend to, like to say, pulpit messaging, will listen to what is coming from the pulpit. And so that's what I would say. The key is universal messaging, making sure everybody is speaking the same thing and dispelling the myth. So if we are able to do that, I think we'll still see an uptake in those who are being vaccinated.
Thank you, Pastor Rogers. I think, Dr. Flynn, we decided we're going to try and hold most questions to the end. It looks like we're doing good on time, so I'll go ahead and transition to Ms. Hobby, if that's okay. Yep, that sounds good. So thank you again, Pastor Rogers. And now I want to introduce our fourth speaker, Ms. Tanya Hobby from the Florida Department of Health, where she serves as the interim administrator in Wakulla and Taylor counties. In 21 years of service with the Department of Health, she's held several positions, including community health manager, tobacco prevention specialist, and a family support worker with Healthy Families and Healthy Start. Ms. Hobby received her undergraduate degree from Liberty University in psychology and a Master of Arts in Human Services Counseling and Addiction and Recovery in 2016. In 2018, she graduated from the Public Health Leadership Program offered through the University of South Florida. Ms. Hobby, can you tell us a bit about some of the challenges you and your team have faced in Taylor and Wakulla counties regarding vaccine hesitancy, and maybe share some of the successes that you've had as well?
Yes, first I want to say good afternoon and thank you for the opportunity to speak on this panel. I think this is a great time to have this conversation. I cannot agree with every one of the speakers that has spoken so far. I truly believe that it is about getting factual information out into the community. I believe that it is meeting people where they are, and partnership is a number one key in getting people vaccinated. That has been a strong component in both of our counties in the rural areas, is touching base with the faith-based organization, getting people that are well known in your community to do a PSA, to write something in your local newspaper. Going out to, when you live in a small county, it may be 33,000 population, but going to those outlining areas that you can touch that population. It may only be 10 or 20, but you're still getting those shots in the arms. That has been a lot of our success. It's actually getting people at the table and partnering with them. We've partnered with local pharmacies. We've partnered with the faith-based and several organizations in our rural counties. Yet again, want to emphasize that it is very important that we get the factual information out into our communities. That's been a big push for us, is getting people to spread instead of people going to the non-factual places like TikTok and Google, getting the information out into our community. That's about what we have done here in the two counties that we've worked with. Most of the stuff that was said prior to me having my chance to present was some of the same things that we have done in the local counties.
And Ms. Hobby, I'll just ask you really briefly, have you had any events or anything recently that you've done as sort of vaccine uptake has lagged a bit more recently?
We have had an increase locally here with our 12 and up, and we have went to, if you're familiar with Wakulla County, we went out into like the rural county areas, the outlining care areas, to offer vaccine clinics in those areas.
Great. So I'm looking here, and Dr. Flynn, too, you can jump in. I noticed you said that everyone can feel free to post. So someone has asked, which I'll just post to the group, is there any information on when the COVID vaccines might become fully authorized instead of emergency use authorization? Do you think this would decrease vaccine hesitancy?
So any of our speakers are welcome to respond to that. I heard this morning that within a month, the Pfizer vaccine should have full authorization. I haven't heard on the Moderna. We have a number of our physicians who are leading the COVID effort with us today. So if anyone has additional insight on the time frame for the full authorization of the vaccines, and then anyone on the panel, if you think that would reduce hesitancy, we'd love to hear from you.
I'll just echo your comment, Heather, that yes, as of today, the expectation is FDA will give full approval in early September. I saw that news release today as well, but beyond that, we don't have anything specific. Full FDA approval is far more complex than the emergency use authorization that was able to move through as quickly. They have to review a lot more data, and that's why it's taking longer. They've had that information for a couple of months now, and they're still waiting before we get that final authorization, but it should come within a month or so.
Great, thank you. And Dr. Poole Burgess, or any of the speakers, I don't know if you feel like the full authorization would have an effect on the hesitancy from your perspectives.
I actually do. I've had conversations with people, and as soon as they hear that it's not fully FDA approved, it makes them draw back a little bit. So I definitely do think that will help increase the, the uptake, decrease the hesitancy.
So it looks like Dr. Rust has his hand up. Maybe I'll call on him and keep looking at the chat here.
Sure. I actually can comment on that, and then I had a question as well. But the only additional thing I'd say about the going to full authorization or full approval from the FDA is that we do hear from a number of employers that the EUA is making them hesitate to do vaccine mandates. We would dearly love to see, for example, nursing homes requiring workers who are exposing vulnerable patients. That would be a lovely place to think about a vaccine mandate. And a number of other employers are talking about potentially vaccine mandates, but not having full approval from FDA has been considered a barrier by some lawyers, particularly, to implementing those kinds of mandates.
If I could ask Dr. Russ? Yeah, please.
Yeah, and I just wanted to direct this to Dr. Roberson, who I really want to call out as being a champion for public health in Florida. She's just been an incredible leader and particularly a voice for health equity within the Department of Health and throughout the state of Florida, and a champion and in sometimes difficult times. Let's leave it at that. One of the things that our community partners ask us for is to maintain trust and to have transparency, and particularly around racial ethnic disparities in vaccination rates and in cases, the disparities. And I've got a note from Dr. Temple Robinson this morning saying that she was actually having her staff give out vaccines at wakes and funerals. And she said she used the word medieval, that it feels just awful to be in that position. But I wonder what we can do to facilitate our local health departments being able to share granular data with our community partners around, race-specific rates of vaccination and race-specific rates of COVID cases, because we get asked for that routinely. I know Dr. Strong asked me for that on all of our provider calls. Dr. Roberson, what can we do to make that kind of data at the local level available to our community partners?
Yeah, so this is a routine thing that we do on a regular basis with our other community partners and our FQHCs. So I think, really establishing a touch point between the CHD, that EPI team, that health officer in that county, to have those conversations with the other medical leadership, especially people that, want to target certain communities. That's not a problem. So if there needs to be some communication between the two to really have those conversations. So for example, really talk through, in other counties, I've seen those health officers talk directly to FQHC CMOs and CEOs to say, these are the areas in the counties where we want to see an increase in vaccine uptake. This is a part of our surveillance plan that, we're seeing an increase in spread of the virus in certain communities. But just want to note right now, there is such high transmission rates in the state. So really, there are universal messages about, mitigation and other things as it relates to cases. But in terms of vaccine uptake, that is a direct relationship with those medical and community providers with that local health department to say, these are some of the areas where we want to focus on, and really taking a community approach to develop strategies to say, hey, faith-based organizations in this area, we see a high rate of transmission. We see low vaccine uptake. These are some of the things that are proven, tried and true. So being a little bit more proactive and just not, allowing for the public to have to ask you. Sometimes people don't know what they don't know. So really taking that proactive approach of having those local public health professionals with those local medical providers to go out in uniformity to say, we would like to offer some vaccines in your community. Vaccine rates are low. And really, having that routine conversation established so that they understand where we are on a regular basis with vaccines and cases. So we can work on that, Dr. Russ.
Thank you so much. And thanks for all that you do.
No problem.
I also see that Dr. Glukoff has his hand up. So, Rob, did you want to speak?
Yes. Can you hear me?
Yes, sir.
Okay. This is a question for Pastor Rogers, my dear brother in the spirit. You know very well that when we use the term faith-based community, that in some ways it's sort of an amorphous expression, that we have pastors associated with denominations. We have a large proportion of pastors associated with independent churches, and I believe you are the leader of an independent Baptist church. My question is this: what are your suggestions for reaching out to pastors who are associated with independent churches that may not have the same level of oversight and structure as standard denominations in the Black community?
Okay. If I understand you right, you're saying how do we ensure that we are able to reach all pastors? And it's based upon their denominational structures. So within those structures, oftentimes what you will do is approach the local overseer leader of that set group of churches. Like you said, the fortunate thing is being independent, we're able to make those decisions on our own. However, when you're dealing with those that are part of associations and things of that sort, you want to make sure that you approach, I'll just use the AME church as a reference, where you'll reach out to their presiding elder of the area, and then they will reach out to their bishop to make sure that information is funneling down so they're not out of the will and the way of their organizations. And so a lot of times it's just communicating between pastors. We have a network of pastors in Gaston County, and those pastors may be a part of different denominations. But at the end of the day, I think what we have to promote is the overall health of our communities and not necessarily be specific to our own isolated areas. While I pastor in Havana, I'm a resident of Gaston County. And so I want to make sure all residents in Gaston County are healthy and their needs are met. And so we make sure that we touch pastors in all of those areas. So I believe if you understand the organizational structure of the denominations or church organization or faith-based organizations, and you approach the right persons within that, I think we'll meet that goal.
And just to add to that a little bit, so in Florida, we have received new money from the state legislator, and we have received new money from the federal government to really expand our health equity efforts. As a part of the new legislation that's required by the Florida Department of Health, we are required to have a health equity liaison in every county in the state. That was in implementation from July the 1st of this year. With that being said, some of the things that they're working to do is a community partnership assessment early on to really document those community partners and really get the information so that we can have emails, phone numbers of people to send out information. So as a part of that environmental scan, we will task those health equity liaisons to really do a partnership assessment, including faith-based leaderships, and review it on a regular basis so that we can send out those messages. And then that'll kind of get us, away from what you're saying. So certain, missionary Baptists or AME, those different churches in different communities, they have a bigger structure where they can force, multiply, and share. But with this localized approach, we'll be able to get some of those independent leaders, and then they'll be able to have routine messages for COVID-19, for chronic disease prevention, for HIV intervention. And then it's a feedback mechanism too. So not that we're just sharing information, but they'll have the contact information of these health equity liaisons so that they can ask for resources, look at the needs of their community and share with us so we can bring the community what they need with a localized grassroots approach, and then bring that up to central office so that we can continue to address and bring money from the federal level and from the state level. We've received an additional couple of $1 million from the state legislature, and we've received over $30 million from the federal government to address health equity needs in the state of Florida. So we're very proud of that. And then there's a separate allotment in Duval County and a separate allotment in Miami-Dade for enhanced health equity efforts from the federal government. So we have a much expanded capacity for health equity activities in the state of Florida. And we want to use some of those funds and those strategies and interventions to really make a difference. So we have an opportunity in the state, and that big policy change, we expect to see a difference made from that. We're very proud of that.
Thank you both, Pastor Rogers, Dr. Roberson, for your responses and significant efforts in bringing the message to the diverse community of congregations within the Black community and elsewhere.
I'm afraid we will be running out of time before we can address the additional questions. We have saved your questions, and we will disseminate some responses through email. Before we wrap up, I want to say a sincere thank you to our panelists, Dr. Roberson, Dr. Poole Burgess, Pastor Rogers, and Ms. Hobby, and for Dr. Howren for all of your amazing moderation of the session today. We really appreciate it. Thank you for the physicians, Dr. Van Dermy, Dr. Rust, who jumped in with some questions. I have to do another special shout out to Mr. Marcus West from the Leon County Health Department. Marcus has been leading the way in terms of getting accurate information out there to communities. I don't want to put Marcus on the spot, but I know he's developing a toolkit that I think will be available at some point with some wonderful information. We can follow up with you if it's okay with Marcus on that one. So thank you so much, everybody. We really appreciate your engagement, and I know that you're all very well equipped to go out and be wonderful ambassadors for public health. So thank you all so much, and have a wonderful afternoon.
Thanks, everybody.